The following recorded program is part of the Mount Sinai Medical Center Lecture Series, offered by Mount Sinai Medical Center in cooperation with the City of Sunny Isles Beach.
Good morning, everyone. As Regina said, I'm Dr. Gonzalez. Nice to be here. Thank you guys for coming. I know it's the first lecture of the series, so I appreciate everyone being here in attendance. Today I picked the topic cervical cancer because this is something I talk about a lot in the office, and it's a bit confusing, so I wanted to probably just clarify a little bit for patients out there and hopefully answer any questions that you might have. Okay? So basically, the topic is, when should you get checked for cervical cancer? When we're talking about cervical cancer, we're really addressing a virus called the human papilloma virus and the Pap Smear. Okay? So what is cervical cancer? Cervical cancer is basically, it's a cancer of the type of, it's cancer that occurs in the cells of the cervix. And the cervix is the lower part of the uterus that connects to the vagina. Whenever we're talking about cancer, there's an abnormal growth of cells. It's cells that your body can no longer regulate, and they just grow out of control. Okay? Cervical cancer in the United States has decreased by 50% over the last 30 years, and this is absolutely due to the advent of the Pap Smear. Every year, about 2.3 in 100,000 women will develop cervical cancer, so actually the incidence is pretty low. It's the third most common gynecological cancer after uterine and ovarian cancer. Most of these cases occur in women who've never had a Pap smear or are screened infrequently. And virtually all cases are caused by the human papilloma virus. So this is just pertinent to the United States. Across the world, it's a lot more prevalent because they don't really have access to health care and the Pap smear. But here we do a pretty good job of getting women into care. So the human papilloma virus, you might have heard a lot about this over the past few years. It is a virus that is transmitted through sexual contact. Virtually all people contract this virus. There's estimates that about 80% of people who've ever been sexually active in their lifetime have contracted this virus at some point in their life. Okay? There are over 100 different types of the human papilloma virus. There are high-risk types, and these are the high-risk types that can cause cervical cancer. And these usually have no symptoms early on. And then there are low-risk types that don't cause cancer, but they can cause genital warts, and those are the symptoms you might see. It's a transient infection that comes and goes, so that means that your body can usually clear this infection without treatment or medication. However, though, this virus can persist in the body. And if you have the high-risk type that stays in your body, this is what can cause cervical cancer down the line. High-risk types of HPV could cause virtually all cases of cervical cancer, but not everyone that has the high-risk HPV will get cancer. That's the fortunate part of this. Only a small percentage of women with high-risk HPV who develop high-grade changes because of this virus will go on to develop cancer. The percentages, and I'll talk a little more about the results, but a woman who has HPV doesn't necessarily mean the HPV is doing anything to the cells in the cervix. It's when the HPV causes changes in the cells of the cervix, they can be either low-grade changes or high-grade changes. When we see high-grade changes, that's what we say that they're precancerous changes, and this, if left untreated, might go on to cancer. So with the highest grade of precancerous cells, as we like to say, only about 30% of those women, if they are untreated, will go on to get cervical cancer. And the incidence is much lower if you are treated. Okay, so the human papilloma virus, it's common among adolescents and people in their 20s because this is usually when people are starting sexual contact. It is during this time frame that most people contract the virus. Men carry and transmit the virus, but it's not a significant source of cancer in them, so that's why we don't screen them. Okay? But again, this is not specific to females. Both men and females get the virus. Okay, so who is at risk of developing cervical cancer? So we typically see cancer in women aged 25 to 64 years old, and these are some common risk factors they have. Early initiation of sexual activity, a history of or currently multiple sexual partners, women with HIV or other conditions that compromise the immune system, so any autoimmune condition, you might be affected because your immune defenses are lower. People who have a long-term history of smoking, and they say it's not smoking in of itself that leads to development of cancer, but activities that are associated with smoking, multiple sexual partners, not using a condom, History of other sexually transmitted infections. That could include gonorrhea, chlamydia, any one of the other herpes. Or women who have never had a Pap performed or are screened infrequently. So obviously, if you've never had a Pap done, you're at risk for cervical cancer. Or women who've had a Pap infrequently, meaning probably more than 5 years apart. Okay, so is it possible to screen for cervical cancer? In other words, is it possible to prevent cervical cancer? The answer is yes. So that's where the Pap smear was brought about. The Pap smear, really what it does, it screens for abnormal cells in the cervix. And the purpose of the Pap smear is two things. So number one, we're looking for the presence of those abnormal cervical cells. That's what we were discussing before. Basically, are they precancerous cells or are these actual cancerous cells that we're looking at? And the second thing that the Pap smear looks for is the presence of this high-risk Hpv virus, because we know that that high-risk Hpv is what causes cancer. We only look for HPV in women aged 30 years and over. Kind of as we said before, we know that in adolescents and women in their 20s, they are most likely going to have HPV and the high-risk type. But given their age, their body can usually clear it, and it's usually after the age of 30, what we would call a persistent infection. So that's why we don't check until after 30. We give your body a chance to clear itself of the high-risk infection. And if you have high-risk infection, these women, because of their immune defense systems, usually don't develop cancer in that early age. Okay? So again, a little more about the Pap smear. So this is just a sample of the cervical cells that's taken. We do this in the office using a speculum and a cervical swab. Most women have had this done in their lifetimes. And those cells are sent to the laboratory for analysis. And the laboratory will tell us if these cells are normal or abnormal. Okay? If the cells are abnormal, your doctor may inform you that you might need a small biopsy in the office, and that's what we would call a colposcopy. Or sometimes it's necessary to have a larger biopsy, and that's what we call a LEAP or a cone biopsy, and that's done in the operating room because we need anesthesia for that. Okay. So when should you get a Pap smear? Basically, every woman over the age of 21 should start to be screened with a Pap smear. In about 2012, the guidelines were changed. It used to be based off when you started sexual activity, but that's no longer recommended. So at the age of 21, everyone should be getting a Pap smear, regardless of whether you started sexual activity or not. And if you started sexual activity prior to 21, you don't need to start earlier with the Pap smear. If your Pap smear is negative, you can repeat the Pap smear in either 3 to 5 years, and that interval is determined by your doctor. So it's no longer necessary to do the Pap smear every year. If your Pap smear is abnormal, again, you might need a biopsy, like we just discussed, either in the office or in the OR, and you might need to get the Pap more frequently than every 3 or 5 years. Women who are aged 65 years or older can stop being screened with the Pap if they don't have a history of abnormal high-grade cervical changes on a previous Pap smear. And most of the time you would know that because that would have necessitated some kind of biopsy in the OR. Okay. Is there anything that you should do to prepare for the Pap smear? Yes, you should avoid intercourse or any vaginal creams, foams, or douches, spermicides 2 days prior to the Pap. Preferably, we would do the Pap while you don't have your period, and ideally it's done 2 weeks after the first day of your last menstrual period. You can still do the Pap smear while you're menstruating. The technology now can actually filtrate out the blood, but it's definitely advisable to avoid any vaginal creams or anything foreign in the vagina for the 2 days prior. Okay. What about women who've had hysterectomies? So there are actually 2 types of hysterectomies. One is something called a total hysterectomy. That's where your uterus and your cervix was removed. If you had your uterus and your cervix removed for any other reasons aside from an abnormal Pap smear, you can discontinue getting the Pap. So even if you're 40 years old, you've never had that history of abnormal Pap, you can stop getting the Paps done at that point. Okay. There's another type of hysterectomy where they only remove the uterus and they've left the cervix. If that's the case, you continue routine screening until 65 years old. So you would get your Pap smear either every 3 or 5 years, and that's determined by your doctor. Okay, so what are the different kinds of results that can come back on the Pap smear? So to be clear, the Pap smear is something we use for screening. And in the medical world, screening is different from an actual diagnosis. So if your Pap smear comes back abnormal, that doesn't necessarily mean that you have precancerous cells or that you have cancer. It just means we have to test a little further to see what's actually going on. And we call that coming to a diagnosis. Okay? So for Pap results, there are a few, it's a little complicated, and definitely we'll take questions at the end if you have questions on the results. There's a few different results you can have. It's basically a range from negative, perfectly normal cells to severely abnormal cells. So one result could be negative, all your cells appear normal. Next result could be something we called ASCUS, which means atypical cells of undetermined significance. And basically what this is saying, these cells potentially might be abnormal. We're not sure. We need something further to confirm whether they're normal or not. And that's usually we do an in-office biopsy for that. Or the Pap could come back saying there are some abnormal cells, but they're mild in their changes. So we call this low-grade changes. Again, this usually requires an in-office biopsy and repeating the Pap in 1 year. And for high-grade changes, this is something where they're seeing moderate or severely abnormal cells. And this would require that larger biopsy in the operating room, what we call a LEAP or a cone biopsy. We do that for diagnosis, and that's also for treatment. To basically, we're trying to carve out the abnormal cells, prevent them from growing and spreading to the normal cells. Or lastly, the Pap might come back as carcinoma, which is another way of saying they've detected cancerous cells. Everything except for carcinoma, so the ASCUS, the low grade, the high grade, those are what we call precancerous cells. Those are not cancer. Okay? And if a woman has any one of those changes, that does not mean that she's going to develop cancer in the future. Okay? So a lot of times, I have women who ask me, they say, why can't I do the Pap every year? I'm so used to doing the Pap every year, and absolutely prior to 2012, we were doing the Pap about every 1 to 2 years. However, in 2012, they've changed the guidelines, and they've said that it's no longer necessary to screen with the Pap every year. Why is that? So they did a bunch of new, scientific studies, and they showed that because this disease, it's so slow growing, that we could actually space out the Paps. When we were doing the Paps every year, it led to a lot of over-testing and a lot of biopsies in women, especially in young women, that these women eventually ended up clearing the virus. So they realized if they ended up waiting a while, that most women will clear the virus and don't really need these biopsies. One of the concerns with doing biopsies in these young women, because as we said before, it's usually adolescents and women in their 20s who have these high-grade changes, is that if you're taking out a portion of the cervix, if they become pregnant later in time, they might be at risk for preterm birth because the cervix isn't strong enough to hold the baby inside. Okay? So as I said before, women who have high-grade changes, if we don't do anything, the chance of them getting cancer is only 30%. I mean, it's still high, but it's 30% is better. It's better than the 70% of not. I'm sorry, 70% of women won't get it. And we know that women who have these high-grade changes, if they are to develop cancer, it takes about 10 years on average to develop cancer. So it gives us a long time to either get the woman into treatment or get her into screening for Pap. So given all these things, that it takes a long time to actually develop cancer, and that doing the Pap every year was leading to a lot of unnecessary biopsies and screening, our organization decided to space out the Paps, and they said, for women aged 21 to 30, they can get the Pap every 3 years. And women aged 30 and over, they can get the Pap either every 3 years or 5 years, and that's determined by your doctor. Okay. Now, is there anything that you can do to prevent cervical cancer? So actually, there is a vaccine available. It came out, I believe, a little over 10 years ago. And this vaccine is for men and women, since men still do get the virus. And it's geared towards men and women aged 9 to 26 years old. It's a vaccine that protects against 9 of the high-risk types of HPV. And it's a series of 3 shots you would get over 6 months. The reason for giving it to men and women as young as 9 is because you actually want to catch the people and give them the vaccine before they're actually sexually active, before they even get a chance to contract the virus. Okay. Secondly, you can use condom during sexual activity, and this is to decrease the risk of contracting a sexually transmitted infection. Again, the human papilloma virus is a sexually transmitted infection, and although condoms can't 100% prevent any infection, it can help decrease the risk that you're going to contract HPV and any other kind of sexually transmitted infection. Also, living a healthy lifestyle, avoid smoking, maintaining an ideal weight, and eating healthy are all things that can help promote your health in the long run. Okay, so what are the key points from today? So again, cervical cancer is caused by a high-risk type of HPV, but only a small percentage of women with this high-risk type of HPV will actually develop cancer. And if you are between the ages of 21 and 65, you should be screened every 3 or 5 years with the PAP, and that's according to the time frame determined by your doctor. Because there is this vaccine available now, you should encourage your family members aged 9 to 26 to get the vaccine to prevent the spread of this virus. And also using condoms during sexual activity to decrease the transmission of HPV and other sexually transmitted infections is recommended. That's all I had for today. It's pretty short, but again, it's kind of a complex topic because we're talking about HPV, we're talking about the Pap smears, and we're talking about cervical cancer. Those are 3 different things that, that kind of encompass the screening for cervical cancer. So does anyone have questions about, sure? I think she's just going to come over with the microphone.
Why do they stop screening at age 65?
Right, because if a woman has a history of negative Pap smears, there's a low probability that she's going to contract the like a high-risk type of HPV at that age. And again, if she contracts it, that doesn't necessarily mean it's going to go to cancer. It would take a really long time, and it would have to be the high-risk type leading to the high-risk changes, and again, that takes a really long time. So they say for a woman who has this negative history of Pap smears, it's okay to stop at that point. For someone who has that history of the high-grade changes, we would keep going because we know that they're at risk. Okay.
Anybody else?
You had a question?
Oh, sorry.
Oh, thank you. All right. So for women over 65, whether they're sexually active or they're not sexually active, either way, you say they can skip?
Correct. As long as you've had that history of negative Pap smears, and even kind of we talked about it's a range of the results you can get back. Even if you had low-grade changes at some point in your lifetime, that's okay. When we're not going to stop is if you ever had a Pap smear that showed you had high-grade or severely abnormal cells, we would keep going in that case.
What about that first category of the abnormal ones?
Yeah, so we would stop in that case because that first category was they might be abnormal, but we're not sure. So that's why we go on to biopsy.
And if you have the biopsy and it comes out negative,
then that's fine.
Then you can still quit doing the Pap smears. Okay.
Yeah, only in the scenario where they're doing that bigger biopsy in the operating room and those cells come back as severely abnormal, then we would keep going. So it's a small percentage of women where we would keep going.
Okay, thank you.
Yeah, sure.
Anybody else?
This type of cancer, it is in the gene or is in the infection?
Oh, so, wait, so the question is if this cancer is...
Could be in your gene or your family?
Oh, no, so it's not genetically passed like some other cancers. This is, they say about 95% of cervical cancer is due to this virus.
Oh, okay, thank you.
So that's why it's so important for this vaccine. It didn't exist so long, and so it's fairly new, about a little over 10 years old, so that's why it's so important to kind of encourage the younger generation to get this vaccine with the hope that over maybe 20 years we might see the elimination of this.
Oh, thank you very much.
No problem.
For the science.
No problem.
Okay.
Anyone else?
Thank you.
Well, thank you so much.
Everyone, and